Thank you so much, Dr. Dua, for joining us here on MD Newsline. Can you please introduce yourself and tell us a little bit about your work?
Yes, so my name is Dr. Duah. I am a physician in internal medicine. I also specialize in obesity and lifestyle medicine. So I do a lot of primary care, but also do some extra education and weight management.
Obesity is a hot topic. I feel like no matter what's going on in the world, but I know that a lot has changed in how we end up define obesity. So, what's the current definition of obesity, and what's its current impact on the American population?
Right. So I think in the past, people used to think of obesity more as a moral diagnosis, like someone is not doing exercising enough or eating well enough, and kind of putting the blame on the person who suffers with overweight or obesity. But we now actually have a more, I guess, humane diagnosis or definition for how we talk about overweight and obesity. I think recently the Obesity Medicine Association came out with this definition that describes it as a chronic illness that's relapsing and can recur, that is neurobiological, physiological, psychological, and environmental in its etiology. So it's more so about incorporating all the external factors that govern somebody's weight and their weight management, more so than it being um, kind of blaming the person for being overweight or obese. So it's more looked at as a chronic illness than an issue with the person and their habits themselves.
Can you go into some of those factors, especially with neurobiological? That's the new one that I haven't heard about.
Yeah, so there's a ton of things that manage someone's weight. So in general, our brain, our hypothalamus has a set point, so a body weight set point. All of our brains have, from external and internal inputs, what your brain thinks your weight should be. And because of a lot of external inputs, like what we eat, how we exercise or don't exercise, how what we like supplements and antibiotics, how it affects our gut flora, things that we watch on TV, all of those things are inputs that our brain takes in. And we currently describe our environment as obesogenic, meaning it leads to obesity. So there's a ton of factors that are set up against us that lead to this overweight and obesity epidemic that we have.
So, about what percentage or how much of the population would you say qualifies as being obese? And then what factors go into that qualification?
Yeah, so right now, I think the latest data suggests that about 1 in 3 people are overweight or obese, and actually a larger proportion of that is in the higher classes, so class 2 and class 3 obesity. All the classifications, like we have shied away from calling people morbidly obese. We now use class 1, class 2, class 3, and that's all BMI based. So class 1 is, well, let me backtrack. Overweight is having a BMI between 25 and like 29.9. And then class 1 obesity is 30 to 35. And then class 2 is 35 to 40. And then class 3 is 40 and above. So it's all based on your BMI.